Hi, everyone. Thank you so much for coming to this dynamic learning series put on by Brain Injuries Association of Waterloo-Wellington. I'm Karlee Hall. Thank you so much for having me here today, and thank you for taking time out of your busy schedule to learn a little bit more about this topic. So I'm just going to share my screen and then we'll get into it. Okay, so my name's Karlee Hall. I'm a registered physical therapist, and I am currently doing research at the University of Waterloo, where I'm a PhD candidate, and I am looking at the effect of emotions or the influence that emotional state has on the autonomic nervous system and somatic nervous system in balance control. So, the talk I have today is on strategies and techniques to address the effects of emotional state and nervous system regulation on physical symptoms, physical functioning, pain, and cognitive function. So, I have an article out that's published in Frontiers in Neurology, and I can post a link for this to you if you want to learn more about this topic. But basically, I wanted to pull information from this paper, which looks at a review of that area in the literature, and then marry that with some techniques and strategies that you as clinicians can use with your clients or your patients to address the effects of stress or nervous system dysregulation on their physical functioning and pain. So that's where this all comes from. So I thank you for taking time, as I mentioned, to really learn something new, hopefully, and to be able to apply some new things into your practice. Um, so we'll get started. So I first just want to go over the outline for the session. So we're going to go over the relevance of the topic. So why is this important to do? Talking about what emotional state really is. We'll go over emotional state as a modulator of the autonomic nervous system and somatic nervous system in regards to postural control and movement. And then we'll look at some behavioral study findings in this area. We'll then look at emotional state as a modulator of ANS and somatic nervous system activity as with regards to pain perception. And then we'll look at some behavioral study findings in this area as well. Then we'll look at bottom line for your practice. How do we address the effect of chronic stress or nervous system dysregulation on our clients' symptoms and physical functioning? And then also, I want to build in a discussion here about burnout in healthcare professionals because we can use these same strategies with ourselves to help to regulate our nervous system and prevent burnout, or help if we are in a state of feeling some burnout symptoms. It's a very common issue these days, and it's something that I think we definitely need to take some time as healthcare professionals to take care of ourselves, make sure that we're in a good state, and that way we'll have the best treatments and interactions with our clients as well. So after that, we'll just go over briefly use of outcome measures for ANS activity that you can incorporate if you want, evidence and practical demonstrations of these three techniques that you can use with your clients. Again, these aren't techniques that I have developed. These are just techniques that are well researched. There's a lot of evidence behind them, and I've found them to be particularly effective in working with clients. And then we'll look at practical notes and some concluding remarks. So session objectives, main one is to facilitate understanding of these neurophysiological mechanisms behind the effect of emotional state and nervous system dysregulation and autonomic nervous system activity on pain and physical functioning. Provide an understanding of the evidence behind techniques that you can utilize with your clients to address this, and then empower healthcare professionals with these practical demonstrations of these strategies and techniques that you can use, and a discussion of best ways to use them, how to prescribe some of this in your treatment plans. So let's get started. So in terms of the relevance of this topic, evidence shows that the emotional state and nervous system regulation, or another term we often see is the psychosocial state of the individual, influences the prognosis of an injury. We know that lots of research is showing that, but we often only see this identified in the assessment and not actually utilized or incorporated or integrated as part of the treatment plan. And this is something we want to try to shift, because this is always going to be one thing that you can work on with your clients that definitely influences, has an influence on their pain and physical functioning as well as cognitive function. So our brains are always talking to our bodies and vice versa, and the thoughts we think and the way that we feel has a huge influence, or can have quite the influence on pain levels, on the way we move, how we think, how we feel, our postures, sensations we experience, the way that we breathe, etc. So what is emotional state? I think this is an important thing to understand. Because you often hear about emotions or stress, but I think it's important to really look at how in our brain and in our nervous system is this affecting our bodies and changing the biochemistry of our bodies, for example. So I put this diagram here just to show you that this is a full body response. It's not just something like a thought we're having or feeling in our brain. So emotional responses are physiological responses when the central nervous system detects positively or negatively valent stimuli. So as you go about your day, you're taking in all the sensory information. Let's say you see something that sort of alarms you in your environment, or you come up to a coworker and you had maybe an argument with them and you start to feel a little bit of anger coming up. You're going to not only have those neural networks in your brain engaged, but also this is going to result in a change in the biochemistry in our body. So we might start to, and the neurophysiology. So we might start to have an increased heart rate. We might get the release of cortisol, stress hormone, etc., etc. We might start feeling hot. Then we may go leave that situation and we're walking down the street and we see a puppy that elicits a feeling of joy and happiness and love or whatever it does. But what we have happen is we get different neural networks engaging, release of different hormones and changing in biochemistry. For example, oxytocin, that has a systemic effect on our bodies. So this is sort of how we're shifting through the day. And many people will spend time, a lot of their day, in a certain emotion, or like a bad mood, a kind of a day, or something like that. And so it can shift, but we can also be pretty consistent in the way that we're feeling. But just to know that this is a full body response. In cortical and subcortical areas, this results in changes in arousal levels and cognitive function, such as attention, memory processing, and behavioral strategies. And then in the body proper, this results in changes in endocrine function, autonomic nervous system, and musculoskeletal changes or responses. So feelings are the conscious experience of these autonomic, somatic, and cognitive responses. And then emotional state then is the emotion or the emotional response and its associated conscious feeling. And I briefly just want to review the autonomic nervous system just on very high level. So it governs the function of our organs and glands. There's two branches, parasympathetic and sympathetic. So you often hear parasympathetic, the rest and digest, sympathetic, the fight or flight. And we want homeostasis or balance in these branches and in our bodies. And that's something that we're looking for with some of these treatment or techniques that we can use. We can also assess the ANS. So there's different things that we can look at, like heart rate variability, for example, to get an idea of how someone's autonomic nervous system is functioning. So now let's look at emotional state as a modulator of ANS and somatic nervous system activity in postural control. So I want to go over some of the neural substrates involved, or the neuroanatomical associations between these different, like the autonomic nervous system and the limbic system, the emotional system of the brain. Because I think it helps to inform what we're doing with these techniques, and it also just helps with the intention behind doing these techniques. So if you know how it works and why you're doing it, you're more likely to do it often and create a practice from it. So in the field of balance research, we have a term called central set, and this is defined as the state of readiness of the nervous system for an impending act based on prior experiences and perception of external conditions. And this basically describes how the cognitive emotional state of an individual's nervous system at any given instant in time will influence their response to a stimulus, whether that stimulus is in their environment or, say, a thought that they may be having. So when we think about this in terms of like a real world scenario, the responses in our nervous system when a loss of balance occur, we have somatic motor responses. So we get information from our sensory nerves, so like Golgi tendon organs, cutaneous receptors, etc., sending information. We are then outputting a motor response to correct that loss of balance. We have emotional responses, so changes in the limbic system, in autonomic nervous system, so heightened arousal, for example, and in the endocrine system. And then cognitive responses, so changes in attention, in perception, pulling of context-specific implicit memories to deal with the situation. So this is a figure that I have pulled from the paper I was talking about, and it's just looking at sort of putting together in a schematic, a hypothetical schematic, where just to visually show where we know there's bidirectional connections between different structures within the nervous system. So I'm going to start by talking about the reticular formation. So this is a network of nuclei in the brain, in the brainstem, and it has complex connections to multiple regions, most regions in the CNS, and it's a site of convergence, divergence, and overlap. So it filters input and regulates output. So it has projections to most nuclei in the brainstem, in cortical and subcortical regions, including the limbic system and spinal cord. And the three main functions of the reticular formation are, again, this is a major oversimplification, but if you look at functions listed as autonomic control, respiration, and then postural muscle tone. If you're looking for more detailed information about this in terms of how it affects movement control, you can look at that article where I go a little bit more into depth about these areas. And then there's lots of great research on these areas as well, where you can really get into the weeds of all of this, the functions and connections and things like that. I'm just scratching the surface here. So in terms of reticular activating system, this consists of ascending fibers from the reticular formation. And most of these fibers will relay at the thalamus and then spread diffusely to all regions of the cerebral cortex. And the reticular activating system diffusely stimulates the cerebral cortex, and along with the thalamus is responsible for our level of arousal and attention, and also has a role in modification of postural control. So for example, when you're going to sleep at night, this system quiets down. We get down regulation. Say you hear a loud noise while you're sleeping and you wake up, it's the reticular activating system and the thalamus that are changing your arousal level, tuning you into, okay, what's that noise I heard? What does it mean for me? Do I need to act on that? Etc., etc. So there's bidirectional connections between emotional centers of the brain, so the limbic system and the reticular formation. And the limbic system, some of the roles that it plays are at emotion, motivation, learning, memory, and it operates by influencing the endocrine system and the autonomic nervous system, as well as the musculoskeletal system. So again, this is just very high level. The limbic system consists of 7 different neural substrates. So one is the thalamus, which again, one of the roles is acting as a primary relay station, sensory relay station. The hypothalamus, which is involved in regulation of many important functions, including the circadian rhythm and regulation of the autonomic nervous system. The hippocampus, which is involved in memory. The amygdala, which is involved in rating the emotional importance of a situation and plays a role in processing emotions, and in the literature is largely tied to fear and anxiety. Then we have the cingulate cortex, which is involved in affect regulation and learning from experience. The basal ganglia, which has a role in habitual behavior, emotion, and cognition. And then the insula, which is actually the region of the brain where we have pain perception occurring, and it's considered a limbic sensory area. These two are not technically part of the limbic system, but are heavily connected to it. So the prefrontal cortex, as I mentioned, heavily connected to structures of the limbic system and influences emotive control and movement. And then the cerebellum, which has connections to the reticular formation and the limbic system and is involved in the well-known role of coordination of movement, balance and posture, but also, again, in the literature, the role it has in emotional responses. So it's sharing of information through these connections is one mechanism by which this incoming sensory information and visceral information, so information from organs, can modulate our feelings and our emotional states, and how our thoughts and feelings can influence this altered output through our somatic and autonomic nervous system. So things like changing muscle tone, heart rate, breathing, etc. So just want to go over this fight or flight response with you. So again, this is a whole body response. What we see is when the hypothalamus is activated, we get this activation in the sympathetic nervous system, which activates the adrenal medulla to release epinephrine and norepinephrine into the bloodstream. At the same time, we get activation of the adrenal cortical system by releasing CRF. The pituitary secretes ACTH, and then that arrives at the adrenal cortex and releases approximately 30 different hormones into the bloodstream, one of which is cortisol, which is widely known as the stress hormone. And this, again, this neural activity combines with hormones in the bloodstreams and has this whole body fight or flight response occurring. We can see changes in sensory processing. So in circumstances where along the spectrum of this fight or flight response, it's quite heightened, we can even get tunnel vision, auditory exclusion, breathing rate increases. You might see shaking of the hands, digestion slows, because the energy is mobilized to our periphery, to our muscles, to get us out of harm's way. So muscles become tense, we get relaxation of the bladder, acceleration of the heart rate, etc. Also, the autonomic activity during emotional responses, such as increased respiration or increased heart rate, has a direct modulatory effect on the thalamic nuclei. And this has implications for the way that sensory and motor information is processed or relayed by the thalamus to other regions of the cortex and subcortical areas. And this can result in this high vigilance state or oversensitivity to environmental signals, which then is reflected further in inappropriate autonomic nervous system dynamics. And we know that individuals spend much of their day in some degree of fight or flight, or this increased sympathetic tone. And it can feel quite normal to us, but if you are rushing around or trying to fit a number of things into your day and you feel that sort of rushing or a little bit of stress coming on, that you are in a more sympathetic state, and that might just be a normal. That's very common for people to feel like that's their normal state. But really, we want to try to have more of a balance, or utilize some techniques so that you can shift that baseline so that you're in a more state where there's more homeostasis, more of a balance, increasing some of that parasympathetic nervous system activity as well. And especially if individuals have experienced trauma of any kind, so physical, emotional, it can throw off the balance of these systems if it's significant enough to the individual. And so we want to work as part of treatment, whether it's an injury or a diagnosis or whatever it might be. We want to work with that individual to help to restore balance and regulation to their nervous system. And even if it's been an insidious onset of symptoms, we definitely want to look at, how is stress affecting it? How is this regulation of the nervous system playing a role? So stress, although it's not technically an emotion, it's a constellation of events. It is tied to this fight or flight response, or this increased sympathetic state. So I want to go over this. And everyone experiences stress in their life, so it's an important thing to talk about. So a stimulus occurs, which is the stressor. This precipitates a reaction in the brain. This is the stress perception. And then this activates the physiological fight or flight response in systems in the body. So this is the stress response. And it's important to note that it's the same physiological response that occurs in our brains and bodies, whether we're running from a bear that we see in our environment, whether we're getting stressed out at work, or we're simply thinking about a stress at work. Humans are very unique in that by thought alone, they can elicit this response as well. So you could be sitting at home relaxing, reading a book, and then you think of something that might be stressful for you, and you can elicit this fight or flight response. And I want to point out also that it's short term. This is a very adaptive response. It's helpful. It's there for a reason. So it's not that it's bad. It's an important thing to get us when we're in a situation, like say there is a predator, like a bear, to ensure our survival and mobilize the energy that we need to get out of that situation. But chronically, if you're in that state for much of the day and over a prolonged time, this is very maladaptive, because it's not a state for growth and repair to occur. And so that's where we really want to work on bringing you more balance into that system, and having techniques that when you do have the stress response coming on, that you can quickly, or as quickly as you are able, to bring you back to that baseline of a more regulated state. So I just want to go over some behavioral study findings now, linking emotional state to postural control. So the autonomic nervous system modulates balance reactions, gait initiation, and postural control. And the link between emotions and postural control is complex and involves both direct and indirect mechanisms of action. So this is just pulling a few pieces of information from the literature. This is a wide the breadth of this literature is expansive, and there's a lot of research on it. So if you're interested, I can point you in the direction of some papers that you can look at. I just pulled a couple things to give you a kind of an idea. So deterioration in mood state affects balance, performance, and participants' ability to use input from either somatosensory, visual, or vestibular systems to maintain balance during quiet stance. There's also significant correlation between cortisol awakening response, which is a marker of stress, and perceived stress. And these factors are linked or influence postural control. And we see this as increased COP trajectory. So when we're looking in the lab, At balance, one of the ways we measure that is we have individuals stand on force plates, and we're looking at the ground reaction forces as they move and make balance corrections. That's what I'm referring to with center of pressure or COP trajectory. Also, another finding is that precision of static balance control is more disrupted in individuals with high versus low trait anxiety. So trait anxiety is sort of like the individual's general level or tendency towards anxiety. And then state anxiety, which is situational specific anxiety, modifies the processing of various sensory inputs involved in balance control, regardless of the individual's trait anxiety. So now I'm just going to go over emotional state as a modulator of autonomic nervous system and somatic nervous system activity as it pertains to pain perception. So again, at this point, I just want you to remember that the cognitive emotional state of an individual's nervous system at any instant in time will influence the response to a stimulus. And this includes how an individual perceives pain. So cognitive and emotional factors have a large influence or an important influence on pain perception, and that has been shown in the literature. This is another area where there's a lot of research going on over the last number of years. I think it's important to remind ourselves the definition of pain. Everyone experiences pain in a different way and has their own ideas about pain, but I want to get down to what is pain really. So pain is a complex sensory and emotional experience that can vary widely between people and even within an individual, depending on the context and meaning of the pain and the psychological state of the person at the time. So again, this is a major oversimplification of pain neural networks, but I just want to give you just an idea, very high level. Again, I can point you in the direction of really good papers to look at to start to get an idea of this. This is just barely scratching the surface here, but again, just wanted to give you a little taste of that. So there's multiple pathways in the CNS that are involved in pain processing, and there's bidirectional interactions between ANS and pain networks. And studies show that the neural networks involved in pain processing are intimately linked to the autonomic nervous system. The reticular formation plays a role here as well. So there's involvement of the spinal reticular thalamic pathway as a major ascending pathway for nociceptive transmission to the brain. And the reticular formation relays to the medial thalamus and has been shown to influence the motivational affective components of pain. The reticular formation also performs fine-tuning of nociceptive signals traveling from the spinal cord to the brain and is involved in the modulation of nociceptive transmission from the spinal cord. And there's an association of the reticular formation to descending pain modulation as well. So if a stimulus, like a thought or an external stimulus, increases the arousal through the reticular activating system, we have more arousal, more hypervigilant state, and a more vigilant system overall. And in addition, the activity in the autonomic nervous system directly influences the thalamus, which again, we get a lot of the ascending fibers of the reticular formation, the reticular activating system going through the thalamus, relaying at the thalamus, and then this in turn influences sensory gating. So what sensory information we're allowing to be perceived in our brain. We also have the insula, again, which is part of the limbic system, the emotional processing system of the brain, which is involved in pain perception as well. That's where we have pain perception occurring. It's also been shown that the ACC and insula are important for encoding the emotional and motivational aspects of pain. And then the periaqueductal gray, this is a key structure that's involved in the modulation of pain and sympathetic responses. It plays a critical role in conveying the modulatory influences from higher brain centers that are involved in aspects of pain responses such as cognition, emotion, including the insular and prefrontal cortices and the amygdala. So even with that just very high level, just a sampling of some of the connections there between pain networks and autonomic nervous system networks, it's clear to see the substantial overlap there. And we need to take this into account with regards to how we address pain with our clients and just for their understanding of their pain as well. So I'm just going to go over again, just pulled a couple findings from this wide area of research linking emotional state and pain perception. So just general studies on emotional state and pain perception. So our emotional state has an enormous influence on pain. A negative emotional state increases pain, whereas a positive emotional state lowers pain. A negative expectation can completely reverse the analgesic effect of a clinical dose of opioid agonist, whereas the expectation of pain relief is an important component of placebo analgesia. Complex emotional states such as empathy, which incorporate emotion and cognitive factors, alter the way an individual feels pain. So it's clear here again when you do look at this wide area of research that emotional state influences sensory motor control and balance, as well as pain perception and processing. And with this information, we can be empowered as clinicians to incorporate strategies that address this influence on our physical functioning and pain perception within our clients. So bottom line for your practice. So how do you address the influence of chronic stress and ANS? And also here I want to bring in this talk about how do you as a clinician prevent or manage burnout within yourself, and potentially if you own a clinic or whatever, you could transfer this knowledge to healthcare workers that you're working with as well. So again, anxiety and fear and stress have a direct influence on the autonomic nervous system and the endocrine system, and this has a direct impact on all systems of the body. Again, individuals have been found to spend a large part of their day in some degree of this increased sympathetic tone. I already went over this slide in terms of what stress is, but I wanted to just go over an example of, let's say there was a diagnosis given, or what I'm going to go over right now is like an injury. So say someone is coming to see you and they've had an injury. So the injury is the stressor. They will have this stress perception or this reaction in the brain occurring and activating this fight or flight response within the body. So this is a normal response. When there's an injury that occurs, it's actually advantageous, that's why we have this response, to have the fight or flight response kick in to ensure our survival. So we're becoming more hypervigilant of our environment. Do we need to remove ourselves from this environment? What do we need to do to ensure that we survive, or that we're okay? And that's a really good thing. And what should happen over time is, as the tissues heal, we should see this, or what would be ideal is we would see this rebalancing of the autonomic nervous system from this hypervigilant fight or flight state to a more regulated, balanced state. But what often happens, and I would see this clinically with the majority of the people that I would treat, and this includes healthcare workers as well, that we have baseline stressors in our day that might be influencing how we respond to an injury. And then also, if you add on the stress of, say, a diagnosis or an injury, people say worrying about how is this going to affect my life? Will I get better from this? Am I going to have pain ongoing, etc.? That's all going to influence the autonomic nervous system, and we get this this issue of now tissues have healed, but we're still in this hypervigilant state where we have increased pain, maybe increased sensitivity to light and noise, etc. So this needs to be incorporated as part of treatment to really help to bring balance to the nervous system as tissues heal. So just, I'm not going to go over this in detail, but the purpose of these few next slides are to show you there's a lot of people that are experiencing stress. And so utilizing these techniques with virtually all of your clients is going to be very important. So just one, I'll read one of these. 77% of people experience stress that affects their physical health. This is Global Organization for Stress Statistics. In 2022, 75% of Americans report they experience moderate to high stress levels in the past month. Stress is the number one health concern of high school students, and 80% of people feel stressed at work. So this is something that you can almost guarantee that utilizing this with any individual you're working with is going to be an important thing to do. Here I just wanted to outline that the symptoms of stress often sort of like build on each other, and it can affect virtually all areas of an individual's life. So again, it's something, it can kind of be a cycle as well. So something to think about. So now we'll just take a few minutes to talk about burnout in healthcare professionals and healthcare workers. This is it's becoming a very common thing. And if you look at the numbers in the literature, they're quite high. And it's something that I've experienced burnout in my career as well. And it can have a big effect on the healthcare professionals, their physical function, their mental health, emotional health, also physical health, and has an influence on how we're working with our clients. So we'll go over that as well. So here, 50% of healthcare workers reported feeling burnt out in 2023. This is based on 80,000 assessments of the Mayo Clinic's well-being. Physicians, 49% of US physicians experience significant burnout symptoms, and nurses, it was reported at 60%, and most other healthcare professionals that I looked into, the numbers were very similar to this. So it's an issue that's prevalent among many different health professions. In 2024, 49% of physicians in the US report feeling burnt out. And even in medical students, 58% in 2023 reporting significant burnout. And this is at the beginning of their career, right? So it's something we really want to work to manage. Burnout in doctors, and again, this is in all healthcare professionals. I just pulled from, there's a lot of literature out there with physicians because it's one of the fields where there is significant burnout. So you can sort of insert any of your fields in there and know that the numbers are fairly similar for a lot of different medical fields. But burnout in doctors can have serious consequences for themselves and their patients. They can experience mental health issues, anxiety, emotional exhaustion, suicidal ideation, increased substance abuse, and higher risk of cardiovascular disease, sleep disturbances, and weakened immune system, among many other things. Increase in medical errors. So burned out doctors are 2 times as likely to make a diagnostic or procedural mistake. Again, this can be extrapolated to other healthcare professions as well. Lower quality of care, so this leads to rushed consultations, missed symptoms, fewer follow-ups. This is what the literature is showing. Associated with longer hospital stays and worse health outcomes for patients, and then poor communication can also result. So this leads to misunderstandings, reduced patient trust, non-adherence to treatment plans, and then a drop in patient satisfaction. So if you as a clinician or someone you are treating are experiencing pain, muscle tone and tension, muscle activation issues, which will ultimately obviously influence strength, muscle strength, balance issues, sensory processing issues, hypersensitivity to environmental signals like light and noise, postural control issues or issues with attention, focus, and memory, then, and among other things, then you're dealing with something that's directly related and related to and influenced by emotional state and autonomic nervous system activity, or nervous system regulation or dysregulation. So spending time rebalancing our systems after trauma, or even if there isn't a trauma, just the way society, kind of the pace of it, this is something where everyone hopefully can incorporate these types of techniques and see some real improvements in their life. So it's a key part of recovery after trauma. This is like physical trauma as well as emotional. Okay, so using outcome measures for ANS activity. So you might feel it's important to include measures in your practice of an individual's emotional state and assessment. So I've listed a few just outcome measures, questionnaires that you can use. Also, I want to note that these are obviously prone to error biases because they're based on self-reporting. You might even focus just with the client on if they're, individualize it for them. So if they're just experiencing stress, you can say, how is your stress today on a scale from 0 to 10? 0 being no stress, 10 being the most stress you've ever felt. And you can do that with, a few different ones. So if they experience, stress and fear, often you can do 2 different scales for that. You can really individualize it for the client that way. And it just makes it shorter and more meaningful for them. You can also look at these physiological measures as well. So if it's within the scope of your practice, heart rate variability. So I'll just go over that now. What is heart rate variability? So this is the time difference in milliseconds of each successive beat, and it's influenced by stressors, among other things like sleep, exercise, etc. Again, I'm just going to scratch the surface here with what is heart rate variability. There's a lot of research on this area, but it is an index of autonomic nervous system activity or function. And it's been found to correlate with health and emotional well-being or disease states, emotional regulation, postural control, cognition, attention, reaction time, memory, executive function, and many other factors. Having a high heart rate variability is associated or correlated with improved health and well-being, higher levels of worry and rumination, lower levels of worry or rumination, lower anxiety, and generally more regulated emotional responding. When we look at this trace here, so this is a relaxed versus stressed HRV pattern, we can notice here that the heart rate is the same in both, so 60 beats per minute, around 60 beats per minute, but the stressed heart rate has much less variation from beat to beat, and it's much more disordered compared to this more orderly and more variation between heart beats. So in terms of these heart rhythm patterns, what the research is showing is that when individuals are in a state of, say, love or care, these positive emotions, what we see is this more orderly heart rate variability rhythm, and this is called heart coherence. So we see this coherence, which promotes optimal performance. So this has been shown in mental and physical functioning. Also, what happens is when individuals are feeling frustration, anxiety, worry, stress, we see this more disordered and less variation in the heart rate variability rhythm. And this has been shown to impair performance. So again, both physical performance and cognitive performance. So now I just want to get into evidence and practical demonstration of these 3 different techniques that you can use with your clients. And we'll sort of just continue with those last few slides that I've been talking about with heart rate variability. And what we know is that 85 to 90% of the fibers making up the vagus nerve are actually afferent, so they're bringing information from the body up to the brain. And often what we think of with heart rate is that people think that the brain is regulating the heart, and that does occur, but we actually have, again, these 85 to 90% of the nerves are afferent, so we're getting information, this cardiovascular related afferent neural signal transmission that significantly affects activity in most higher centers of the brain, as well as cognitive processes and emotional state. So we want to work to improve cardiac coherence because it has an effect on emotional state, autonomic nervous system activity, cognitive processes, including attention and perception, respiration, blood pressure system, etc., and by association, the somatic nervous system activity as well. So the heart is always sending information or signals to the brain, and this information received by the brain significantly affects cognitive processes, how we interpret sensory information such as light and noise, for example, pain perception, how we think, how we feel, and our breathing, among many other things. So during stress and negative emotions, the heart rhythm is erratic and disordered, and the corresponding neural signals that travel from the heart to the brain inhibit these cognitive functions in the brain. During positive emotions, or these more states of regenerative emotions like gratitude or love, there's a more ordered and stable pattern of the heart's input to the brain during these states, and this has the opposite effect. It facilitates cognitive function and reinforces positive feelings and emotional stability and decreases stress response in the body. So therefore, learning to increase heart rhythm coherence by sustaining positive emotions or even just slowing your breath or your breathing not only benefits the entire body, but profoundly affects how we perceive, how we think, how we feel, how we perform. So it's an important thing to incorporate some of these techniques. So let's do a technique that has been shown. There's a lot of research on this, and there's lots of different techniques that you can use. This is one that works again to promote cardiac coherence, and this is a technique that is developed by HeartMath. Go check out the website. There's a lot of resources, a lot of literature there, studies, and then many different techniques that you can utilize. So we'll do this right now. So I just want you to sit back in your chair and focus your attention on the area of your heart. I find it can help to place a hand there. And just imagine your breath flowing in and out of your chest area, breathing slower and deeper than usual. And then I want you to activate and sustain a regenerative feeling such as appreciation, gratitude, care, or compassion. And I find it can be helpful to think of someone or something that you're grateful for. And if this hasn't been something that you have practiced, sometimes when we first do it, it can feel hard to bring on that feeling just on command. So just know that even just slowing your breathing rate is starting to get you into this more coherent state. And with practice, you'll be able to bring on these feelings such as gratitude. And then radiate that renewing feeling to yourself, to your body, and to others. And when you're ready, you can open your eyes. And then I just want you to sort of take note of how you feel. So was there a change in how you feel in your body or in your breathing or in the way you're thinking, for example? And like anything, the more you practice, the more benefits you'll get from this, and the better you'll get at it. It's a practice like anything else. Um, so I will go over some of sort of like the prescriptions almost of how you might use this within your treatments, but definitely important to help someone get into a state of coherence before you work with them. Because if someone has just rushed to your clinic, they're going to be in this heightened sympathetic state, and that's not a time for healing and repair. There's more muscle guarding, there's more tension. So whether you're just trying to discuss something with them, educate them, or do some hands-on techniques or exercises, whatever it is, they're going to receive that treatment much more effectively when they're in this state where they're coherent. Again, it promotes optimal performance. So even if they're going to do exercises, you want them in this state, right? So this is something to think about maybe while they're waiting for your appointment, and then you can prescribe this, for lack of a better term. You can advise the individual it would be good to do this as an exercise every morning and maybe every night. And then they can use this technique throughout the day if they feel symptoms coming on or stressors. But I'll go over that a bit more detail with that on the upcoming slides. So now we'll go over the second technique that you can use. So this is called physiological sigh. This is based on respiratory arrhythmia, which is one of the physiological basis for heart rate variability. When you inhale, your diaphragm will move down. This increases heart volume slightly, and the blood in your heart moves more slowly in this larger volume. And as a consequence, your brain sends a signal to your heart to speed up your heart rate. When you actively exhale, the opposite happens. So the diaphragm moves up, your heart reduces volume slightly. This causes the blood inside your heart to move more quickly. And then as a consequence, your brain sends a signal to your heart to slow your heart rate down. So when you actively exhale, you're able to deliberately slow your heart rate, and this can really help with stress and anxiety. And this works very quickly, literature shows. So let's do another technique. So for this, you're going to inhale through your nose, layered by another inhale on top. And then you're going to actively exhale with a sigh. So again, inhale, again, layered on top, and then exhale with a sigh. And you would do about 3 to 5 cycles of this, or however many you feel you need to feel more calm. We'll try a couple more without me coaching you what to do. So we'll inhale. So again, you can use this before you start working with your patient or client. You can advise them to use this as a tool if they're feeling stress or anxiety coming on, to modulate that ANS or stress response. It's a fast acting, so it can be a helpful one. It's a little less sneaky than the cardiac coherence. So even if you were in a meeting and you started feeling stressed, or in an appointment and you started feeling stressed, you could go into that heart coherence without really anyone knowing what you're doing. Whereas the physiological side, it's a little bit more noisy, but feel free to do it whenever you want. So now we'll talk about mindfulness meditation. So there are many different types of meditations the literature is really astonishing, the effects of meditation. I have a meditation practice that I do every day, as well as coherence techniques, and has changed all areas of my life in such a positive way. I will just continue to do these types of techniques because they just keep seeming more and more beneficial as you do them more and more. I think in terms of a starting place, if you haven't if you're not familiar with meditation, you can start with any of them. I think that's great. There's a lot of awareness, I think, about mindfulness meditation, so that's why I've chosen to talk about it here. And there's this paper here. It's a review paper by in Nature, and they looked at different brain regions that are affected by meditation. What they found was, and so this is over a bunch of different studies, and they've compiled the findings. So 8 brain regions were consistently altered structurally among meditators. I won't go over all of them, but one important one to your practice is sensory cortices in the insula. So these are areas related to body awareness and sensory perception. This is, again, involved in pain. Just for time's sake, I won't go over all of these, but definitely areas known to be related to self regulation and emotion regulation. Reduction in emotional interference by unpleasant stimuli if you're practicing mindfulness meditation regularly. Decreased physiological reactivity. So again, this decreased kind of fight or flight response. And also, and importantly, facilitated return to baseline after a response to a stressor. This is very important. It's also been found that mindfulness meditations have been shown to increase activities in cognitive regulation and nociceptive processing, so the ACC and anterior insula, areas involved in reframing the evaluation of stimuli, so orbital frontal cortex, and then decreased activity in the primary somatosensory cortex. And importantly, a study that looked at the correlation between neural and self-reported findings has demonstrated that the prefrontal cortex amygdala connectivity occurred. So we have changes in the connectivity that occur with mindfulness meditation, and these are correlated with anxiety symptom improvement. So that's an important thing. So we're seeing changes with the connections, and we're also seeing that they are reporting symptoms of anxiety are improving. Another thing I just want to briefly go over is when we can measure, obviously, brain activity, brain electrical activity, just like we can measure heart rate, heart electrical activity. So what we see is there's different brain waves depending on different states that we're in. So beta brain waves, this is when we're alert, we have normal consciousness, we're focused. That's probably what you're in right now. You're listening to me talk about this information. If I told you, okay, you're going to be tested on this information right after this, you might go into more of a stress state or this high beta brainwave. And what we also see is when individuals are in that stress state, we also get different neural networks in the brain now start to work less synchronously. They're not working as well together. Meditation works to slow the brainwave, so not only slowing them into this alpha or theta brainwave, but also making the brain more coherent, where we see, again, different neural networks in the brain now working more synchronously or working together better. And I like to use this sort of visual here, where when we're in a more stressed state, it's like drummers beating at random. It's just not a very effective state to be in. When we're in a more coherent state, and having different neural networks in our brain kind of work together synchronously, we have this coherent state where we're having, it's almost like drummers beating to the same rhythm. It's just much more effective. So for the sake of time, I'm not going to run through the actual meditation, but I think there's lots of meditations out there, very beneficial. The mindful movement is one that's on YouTube. You can look, and there's free meditations there. I really like this 5-minute guided meditation for gratitude. It's a good starting point for someone who hasn't really maybe meditated before. There's ones for focus on pain reduction, many different types. I really like to do Dr. Joe Dispenza's meditation myself and the mindful movement, but there's many different meditations out there that you can look for. So I'll just kind of go through here. So we'll get to practical notes and concluding remarks. So I just want to remind you that the human body has innate healing capabilities, and we have the power to take our healing into our own hands and to empower this in our clients and to give the body of our clients and ourselves, if we're practicing these techniques, the state that facilitates growth and repair, or the more homeostasis in the body. And by regulating our nervous system, we can facilitate over time changes to our symptoms. And this is very important to understand and can be very empowering for our clients and for ourselves. And by getting our nervous system into a more regulated and coherent state, we can improve pain, muscle tension, muscle activation, altering the way we're perceiving sensory information so that we're not as hypersensitive to noise and light, for example. Attention, focus, the list goes on and on. And the way we move, right? How we perform. Being in a heart coherent state has many positive effects, such as improved health and well-being, improved emotional regulation, cognition, attention, memory, improved pain levels, improved immune function, cardiorespiratory function, etc., etc. So it's a very important thing to incorporate. And a little bit can go a long way. So studies show that practicing heart coherence, even as little as 5 minutes a day, twice a day, can have very positive impacts on our health and well-being. And like anything, you'll improve with practice. So it might be a bit of a learning curve at first, because many of us aren't used to paying attention to our bodies. We're used to being busy and paying more attention to our outer environment. And so it can be quite the learning curve at the beginning. So you just practice a little bit at a time, and the more you do it, the better you'll get at it, and the more benefits will start to sort of snowball. You can do these techniques as exercises to shift the balance in your autonomic nervous system, and that's what we ultimately want to work to, being in a more coherent state through the heart coherence and our nervous systems throughout the day, so that we are more regulated just all the time. And we have tools to bring us into a more regulated state when we are triggered into the more of a fight or flight response, or the sympathetic state or stress. So you can, again, do them often every day to shift that baseline. And you can also use them as symptoms come on. You can utilize these techniques as well. Or if you have a stressful situation come up, you can utilize the techniques in the moment as well. So again, start with 5 minutes a day, then you can increase to 2 times daily, increase time and frequency over time. If someone is a regular meditator, you can start with a higher duration, obviously, right? Use these techniques again as real stressors come up. So you're in traffic, you're in an argument, you're worrying, your symptoms are flaring up. Those are all times you can use them, but also again, as just a practice that you have to start to shift the regulation of your nervous system every morning, every night, something like that it can be very, very effective. Again, these techniques are shown to result over time in a change in the baseline there. So we want to be more regulated as often as we can within our nervous system, right? Also, note for acute injury, the autonomic nervous system's involved in the response of the nervous system to injury and influences the response of the body system to that injury. So again, the cognitive emotional state of the individual at the time of that injury, during the injury, and following will impact the trajectory of the injury and the recovery. And so we want to bring homeostasis to the system so that it can execute healing efficiently and effectively. Lowering the fight or flight response can help the recovery on a number of levels. We've gone over kind of the different areas. Even something as simple as just adding a breathing exercise, or having a discussion about breathing with your client, because a lot of people are sitting a lot in the day, or they're in a stress state where they've maybe habitually started just breathing more shallow, quick breaths. And this alone, just even if you're not really thinking about something stressful, you're not in a stressful state, just changing, having that habitual, shallow, quick breath is shown with lots of research to elicit a more of a sympathetic state in the nervous system. So just educating your client or patient on diaphragmatic breathing, and just being aware, every hour, maybe if they're sitting throughout the day a lot, checking in with themselves. How are they breathing? Maybe do a few diaphragmatic breaths just to break that cycle of sort of that shallow, quick, apical breathing. And this really helps to lower the arousal response. Also really aids with the lymphatic system. So cleanup of, after an injury. That's just, as the heart is like the pump for our cardiovascular system, the lymphatic system, the pump is muscles pumping, right? So breathing, the diaphragm movement is a big factor. And then cardiac vascular responses. So the way someone breathes influences ANS activity, and we want to be mindful of that. So we want to educate our patients or clients to do this throughout the day, as I mentioned. And as always, I think it's very powerful to test and retest. So you might do your assessment, and then you might have someone just start by doing 5 minutes of cardiac coherence, or, physiological sigh or meditation, and then retest those same things that you looked at. So one thing I would often find is sometimes it would seem like, say, for example, an individual has quite a large restriction in range of motion of the shoulder. And then you get them to do these techniques, and in that same session, really what it was all the muscles around there were just, guarding and more in tone, because their body's in more of that sympathetic state. And when you get them out of that state where we're getting this parasympathetic response, now the muscles relax and they actually have almost full range or full range. And just an effective way to really see some changes quickly. And then they see what effect it has on their body, and then they're more likely to use these techniques. Encourage the client to take a moment to tune in to themselves pre and post techniques. So pay attention how they're feeling, how their mind feels, how their body feels, how their breathing feels, and educate them that with practice they will improve with time and repetition. Education is super important and empowering. So even creating a handout that's specific to your area of expertise. And you can educate them that you're giving them techniques to regulate their nervous system and to help improve muscle tension, pain perception, healing, etc. So not all of our scopes include talking about emotions or emotional state or anything like that. So we can talk about nervous system regulation and just give some strategies for this without really getting into the emotional state and all of that. So thank you so much for taking time again. I really appreciate that you are learning more and that you continue to refine your practice. That is amazing. I will put up some of the references here if you're interested in looking a little bit further. And that's all for now. So thank you again so much. It's been my pleasure to do this dynamic learning series, and I thank you all for listening.